Welcome to this edition of Cardinal Clips. We're here today to talk to Dr. Liz Nesset, a 1995 graduate of Willmar Senior High. Liz, I'd like to welcome you back to Willmar. I'm glad you're here to visit with me today.
Thank you. It's interesting to come home again. I haven't been at the high school in 18 years.
Oh, wow. That must have been not too long after you graduated then. It's been a long time then.
I haven't been back.
How about if you catch us up on what you've been doing since you graduated? Where'd you go to college?
After I left Willmar, I went to College of St. Benedict and St. John's University just outside of St. Cloud. I went there because it just felt right for me when I went to interview for scholarships. I majored in chemistry. I thought I was going to be a biology major, but fell madly in love with the problem solving in chemistry. So I got a degree in chemistry. I spent a lot of time doing research, which I thought maybe I should be a PhD chemist. But I had decided I wanted to be a doctor when I was 5 or 6. And so my career path always led me in that direction. In fact, part of the reason I went to St. Ben's was they had a profoundly high placement rate for first-time medical school applicants. So I went there to get into medical school. I was fortunate enough to stay in-state for medical school. I went to Duluth, the University of Minnesota Duluth School of Medicine for my first 2 years, convinced I was going to do primary care and come back to a rural community in Minnesota to practice. So I spent a year in New Ulm as part of the RPAP program, the Rural Physician Associate Program. And it was there that a surgeon first put a scalpel in my hand, changed my life forever. And so when I finished medical school, I was fortunate enough to match at the Mayo Clinic in Rochester, Minnesota, where I did 5 years of general surgery training and then 2 years of plastic surgery fellowship. And right after finishing my training, my surgical mentor offered me a job to go and work with him. So I'm now working at Maricopa County Medical Center in Phoenix, Arizona. I'm a reconstructive plastic surgeon. My practice is primarily facial trauma, soft tissue injuries, skin cancers, and breast reconstruction.
Was there anybody at Willmar Senior High, one of your teachers, that kind of helped you along the way?
Absolutely. There were a few. Probably the most notable for me was George Pepper. I loved the sciences, and I always felt like I was encouraged to ask questions in that classroom. I was one of those geeky students who took extra classes because I thought it was fun. And so my senior year, I had a lot of space in my schedule because I finished a little bit early. And so Tiger and I, as we called him affectionately, I took every one of his advanced biology classes. In fact, the second half of my senior year, I basically lived in his classroom doing any number of coursework that we had kind of made up, and then I TA'd a couple of his more junior level classes, their labs.
Did you ever think about becoming a teacher?
I never thought about teaching specifically or exclusively. I taught a lot in my undergraduate as a chemistry tutor. And in medical school, I enjoyed teaching more junior students. So when I took my position, I actually very quickly after I joined the staff at my hospital became the associate program director for our general surgery residency program. And I'm now responsible for the running of the program. So the education of 29 aspiring surgeons is my responsibility.
Could be a heavy responsibility, couldn't it?
I'm not going to lie, I get a little bit of gray hair from it, but it's amazing. It's truly a gift to be able to help somebody figure out what it is that they're supposed to do, much like the gentleman in New Ulm, Carl J. Poperniak, did for me when he put a scalpel in my hand in my third year of medical school.
Liz, how about family? We all have moms and dads. Do your mom and dad still live here in town? And how about brothers and sisters?
My parents, Ralph and Mary, still live in Willmar, actually. So when I come home, I, of course, stay with them. They've been here for 39 or 40 years, I believe. I have one older sister, Anne, who also graduated from Willmar in 1993, who I still want to be just like when I grow up. Anne is married and has 3 young boys who are my nephews, who are an absolute delight. And they live about an hour away in Brownton, Minnesota.
When you think back on high school, you got to spend, I think, 1 year at this building. What's your best memory of being in high school, if you have any at all?
High school wasn't my favorite time. I was definitely somebody who needed to leave. But if I had to say I grew up in the Willmar public school system. I went preschool, kindergarten through 12. I thoroughly enjoyed my time in the sciences. I took chemistry at 6:40 or 6:45 in the morning with Mr. Gubrud my junior year. My time I spent in Mr. Pepper's room. But I was a band geek. And so I spent an incredible amount of time with Mr. Trokel and Mr. Brow. And I learned a lot about diligence and hard work and how much you could get just by practicing, even if you weren't naturally gifted.
Perspiration does pay off, doesn't it?
It absolutely does. Absolutely does. I'm living proof of that.
When you think of Terry Brow and the music department, did they have musicals back then? Did you do choir?
I'm not a singer, but I did play in the pit band for Bye Bye Birdie was the musical my senior year of high school. I was in the pit band for that. But I was also in concert band and marching band and pep band, and we actually had a fairly active drumline back then. I had a great time in band. I played in orchestra some. I decided at one point that I just wanted to learn different instruments, and so Mr. Trokel, for trade-off of practicing a little bit extra, would teach me how to play the trumpet.
As you look back, you're a successful female. What would you recommend to high school girls who are in school now as they get ready to go out into the world?
It's an interesting question because I've definitely chosen a field that hasn't always welcomed women. Surgery is still a little bit of a closed world for females. We're making inroads, and it's better every year, but there are still a paucity of females in a lot of professions. I will say in high school, I was never discouraged from the sciences. I think we were fortunate in that we had such incredible access to sciences, and not just basic sciences, but advanced level classes. But my advice to women who are considering a career in sciences or math or something that may not be popular, it doesn't matter what everybody else thinks. If your heart is in something, that's all that matters. If you tend towards something else because it seems easier or you don't think there will be as much resistance, you'll never truly be happy. There will always be a part of you that'll wonder what would have happened if I just would have gone for it. I truly believe, for me in surgery, for instance, if I wouldn't have gone into surgery, I would have picked a different career because it was easier or less time or more popular. Eventually, I would have found my way back into surgery because that's what I was supposed to do. I say just go for it in the beginning.
So you kind of think that you were born to be a doctor. Is that right?
Absolutely. It's the only thing I ever wanted to do.
That's not so bad, is it?
Being a doctor or knowing what you want to do early?
Knowing what you want to do.
It let me make decisions along the way. A lot of the decisions I made in high school were to make a more favorable application for college. And the decisions I made in college were to make a more favorable application for medical school. So I was very fortunate in that I figured it out early. Not everybody's so lucky, but I will say that there are enough folks who figure it out later in life. One of my favorite instructors in medical school went back to medical school when he was 52 because it took him that long to figure out that's what he wanted to do. It's never too late to go back, and it's never too late to start over. I was just lucky that I never had to.
When you were in elementary, remember any teachers that you had? What buildings did you attend?
I went to Lafayette on the north side. I remember every single one of my teachers, Mrs. Gander, Mrs. Glazeman, Mrs. Wellner, Mr. Johnson. Tim Johnson was my fourth grade teacher, Mrs. Larson. I was the first class to go to Roosevelt. I was in sixth grade in Roosevelt in Mrs. Miller's class. I fondly remember Mrs. Swift's, who had the advanced level English and math classes. I remember folks from junior high that made a difference, but really I would say high school stands out. Mr. Pepper, the band instructors, Mrs. Tregesser, my English teacher.
Well, I'm glad that your teachers had that much of an impact on you, because sometimes high school teachers get lost in the shuffle of going to college and med school, and you kind of forget about them.
I would say that there are little bits and pieces of every one of those people that I carry with me. And there are lessons that I learned from a lot of them, and that's actually what I'm going to talk about tonight, are the people you meet along the way who contribute to who you are as a person. Every single one of those people either saw I still remember the nickname Mrs. Wellner gave me in third grade. They saw something or helped something develop along the way, and I am who I am because of them.
What was your thought when you got contacted about coming back to where you went to high school to talk to a group of senior students?
To be honest, I thought Minnesota in May. Is it going to be warm enough to go to Minnesota in May? Because I moved to Arizona for a reason. And then I couldn't believe that I was actually old enough to come back and do something like this, because I feel like I was just in high school not that long ago. I was honored. Being asked to come back and speak to a group of students, to me, makes it sound like I've been very successful and I've really accomplished something, though I still feel like I'm working to get to where I want to go. I was not the most popular student in high school. It wasn't the easiest time in the world. I think I struggled as much as any other high school student did. And so it's fascinating to come back as the person that I am now and see where I came from and how far I've come.
As you grow older and you are successful, people have a different viewpoint of you when you come back to visit, don't they?
Very much so, especially when you've been gone for a long time.
Your senior year, you moved to the new high school. How was it different than being at the old Willmar Senior High School?
The best analogy I can give you is it's like going from driving the old hand-me-down car that your parents had and getting a brand new car with all the bells and whistles. We went from this tiny, cramped space to this huge, beautiful new building that had everything. The labs had adequate space and ventilation and state-of-the-art hoods. The theater didn't just have this tiny little sound and light box where you really could only have 2 people in the old theater in what's now Kennedy Elementary. Now you had this state-of-the-art sound system, and the acoustics in there were amazing compared. When I was in high school, we had to go to the COB for our band concerts because there wasn't adequate space in the high school or junior high for them. And now we could suddenly have them right where we were. We didn't have to ship our equipment over. We just rolled it down the hall. It was literally like getting a brand new car with all of the bells and whistles because it had absolutely everything.
In your field, it seems like every week there's another article about technological improvements.
I think about how much things have changed since I was in junior high and high school. We had the old Apple I and Apple II and Commodore computers that truly just had a black screen with green writing on them. I remember when Microsoft Exchange came out my sophomore year of college, and we all thought it was the greatest thing in the world that we now had actual email. And now I have an iPad that I can check on my patients in the hospital right now at home on. I can look at their CT scans. I can look at their labs. I can write progress notes on them and send my nurse information to call. So really, the entire world is at our fingertips now. And I think it's going to get, I think it's only going to grow and evolve. I'm a Trekkie. I like Star Trek. And I remember watching them with their sensors, and the doctor just had to scan somebody and you could find out what's wrong with them. And in 100 years, that technology may be available. The things that we can tell someone now about what's going to happen in their health, or even with robotic surgery, somebody can be doing an operation across the country or across the world. I think the technology is going to continue to explode. And I think the world's the limit. The sky truly is the limit when it comes to technology and how it's going to affect our health.
Has technology affected how you do your work?
Absolutely. If you even want to look at 5 years ago, if I were to get a call in the middle of the night about a patient who had a facial fracture, I'd have to go into the hospital and see them because that was the only way for me to look at their images. I'd had to pull out some films and put them on a light box and look at them individually. And now everything's digital. We don't have films anymore. And so I can literally get a phone call at 2 a.m, pull out my iPad while I'm still laying in bed, look at their films, and tell the consulting physician in the ED what the patient needs. Do they need to get admitted? Can they go home and follow up in my clinic without ever having to go in? It's made some things much simpler.
Next year, all of our 9 through 12 kids will have an iPad that they get to use all year long. They get to carry it with them. They get to take it home. They don't get to keep it, but we feel pretty good about that.
I think it's an excellent program. We've given all of our residents iPads. It truly makes everything in the world accessible. With wireless internet and the amount of information that's available now, the entire world is at your fingertips.
You said you were kind of a teacher. You had 29 people that you're responsible for. Do they use iPads and technology quite a bit?
Every day. In fact, sometimes I have to remind them in conference that they should be listening to the speaker and not playing on their iPad. But absolutely, one of the things that I think is important for everyone to realize is you don't have to know everything all the time. There's no possible way for me to know everything, even about my specialized area of my field. You just have to know where to look for the information. And so one of the things I think that the upcoming generations are better at than even my generation are is knowing how to search for things and how to get information without going to a library and walking through a reference section. It's at their fingertips, and they're very adept at using it.
How did you end up being a plastic surgeon? Was it a field you thought about or just kind of fell into it?
It's an interesting story. I had gone to medical school with the intention of doing primary care. I'd worked in a nursing home, Bethesda Heritage actually, in Willmar here. And so I was going to take care of little old men in the late years of their life, and I thought that's what I was meant to do. So I went to University of Minnesota Duluth, which is a school established to train primary care physicians. And I was so convinced I was going to do primary care that I went to New Ulm, Minnesota for 9 months, my third year of medical school. And I did my surgery rotation while I was there with this gentleman by the name of Carl Paperniak. In the first couple of days I worked with him, I was scared of him. He was this, big gruff surgeon. I thought he was going to make me cry every day for the rest of the rotation. And on day 3, he put a scalpel in my hand and he drew a line and he said, make an incision. And I was terrified, of course, but I got bit by the bug. After that, all I wanted to do was be in the operating room. So when I went back to my 4th year of medical school, now I needed recommendation letters to get into a surgery residency. And even though I worked with Paperniak for almost 9 months, I needed more than just that. Well, the only sub-internship available was burn and plastic surgery at Hennepin County Medical Center. So I went and I worked with some very talented individuals. And then the operation that changed my career path again for the rest of my life was a woman who had lost some weight, 150 pounds. She had a lot of extra skin on her. And we did a 2-hour operation. We did a paniculectomy on her. We just cut off all of her extra skin. She walked into the hospital looking like this little old lady. And she left the hospital looking like her age. She had confidence. It had completely changed the way that she felt about herself. So for me, the idea that with an operation, something I love to do, I could actually change the way that somebody lived their life without having to tell them they were dying of cancer or having to tell somebody what we were about to do was their only option for life. It was a win-win. And so that's what drew me into plastic surgery, is the idea of helping people live a normal life without having to deal with a lot of the negative things with cancer and everything else.
Sounds like a really rewarding field. You make it sound like it.
I can't imagine doing anything else.
Now, you said earlier that you do reconstructive surgery. How's that different from when I go get my knee operated on by an orthopedic surgeon? How's that different?
So reconstructive surgery is a subset of plastic surgery in general. There used to just be surgeons, and then everything got more and more subspecialized. And as one of the Mayo brothers once said, a specialist is somebody who knows more and more about less and less. So plastic surgery as a field is truly meant to restore form and function. When most people think plastic surgery, they think aesthetic surgery, facelifts and tummy tucks and liposuction. But the fact of the matter is only a very small set of plastic surgeons actually do those types of procedures. Most of plastic surgery is truly restoring things to their premorbid condition. And as a reconstructive surgeon, I do that exclusively. I really don't do any aesthetic surgery, any of the cosmetic surgery. So my practice is largely, I do a lot of breast reconstruction. So women who have had mastectomies for cancer, or who have a significant deformity after radiation therapy, for example. I spend a lot of time reconstructing their breast. Folks who are in bad car accidents and have broken bones in their face, or have really bad lacerations, or leave half of their lip on the pavement, or who have a skin cancer on their lip. My job is to go in and reconstruct the lip, not just so that it looks as normal as possible, but that it functions as normal as possible. If you disrupt the musculature around your mouth, you have a hard time keeping your coffee in when you take a drink. And most of those folks don't want to drink a cup of coffee in public because they don't want it dribbling down their mouth. So my job is to restore both the form and the function of their upper lip so they look normal and can go back into society without kids pointing at them and feeling self-conscious of something that happened to them at one point.
Is what you do really highly technical?
Yes and no. Sometimes I joke that it's really just moving tissue around. There are varying degrees of it. There's something called a free flap, where you literally transplant tissue from some part of the body to another part of the body. So if somebody is in a car accident and, say, loses all of the soft tissue over their elbow, well, you have to cover that elbow joint. So you can take a muscle from their back and transplant it to their elbow. But to do that, you have to sew together an artery and a vein. There's got to be, just like in your bathroom, water in, water out, there's got to be blood in, blood out. So for an operation like that, I use a microscope. The suture that I sew with is smaller than the width of my hair. Sometimes you can't see it with the naked eye. So some of it is very highly technical. If you compare that to something like liposuction, there isn't a whole lot to it. It's just a lot of physical work. I would say that how technical what I do is varies based on the problem, but it runs the entire spectrum from almost nothing to highly sophisticated.
Well, liposuction reminds me of just using a vacuum cleaner to clean something out.
It's the same as using a vacuum cleaner to clean something out, but what you're cleaning out is solid, and so you have to physically break it up.
Medicine is a highly competitive field. And what would you tell a young boy or girl what would you suggest to them as they got ready? They're going to graduate from high school, they're going to go to college. What would you tell them about medicine that maybe nobody else would tell them?
I think everything is getting more and more competitive. Getting into medical school, getting into law school, getting into graduate school, or even getting into an MBA program, whatever it is that someone is called to do. I think the advice I would give somebody going into medicine would be the exact same for every other thing. It's never too early to start planning, but don't get pigeonholed. So if you're convinced that you're going to go into a science field, such as medicine, biology and chemistry and physics are very important. But if you come in as this monochromatic candidate with only one dimension to you, you're not going to be as competitive as everyone else. So don't limit yourself. I hate to say it, but try to be good at absolutely everyone. And I think especially for high school students these days, one of the challenges that they may not know that they will face is it's possible now to live your entire life in the public eye, and to put every last detail about who you are and what you do in your spare time on the internet. That stuff never goes away. I Google every single applicant that we interview. And you better believe that that does make a difference in how we make our decisions in terms of who we want to have in our program. So I would say it's never too early to start preparing. Be involved in everything. Be well-rounded. If you want to play an instrument, play an instrument. Don't just pigeonhole yourself into science classes, but don't neglect those either. Be well-spoken. I think a lot of folks underestimate the importance of being able to communicate. And one of the misconceptions about surgery is that you never really talk to patients or develop a relationship with patients. And I would say quite the opposite, because I have to earn enough trust in a very short period of time for someone to be willing to give up all of their faculties and just lay down and believe that I will do right by them. I don't know if there is any more intimate relationship in medicine, but part of that is being able to communicate with someone and explain to them, no matter what their educational or comprehension level, what we're going to do and why. So being able to communicate is important. All of Mrs. Trageser's English classes are essential. Being able to write something that's coherent is absolutely essential, because a lot of the time, the only way that you are heard or understood is through your written word. So I would say that all of it is important. Be as well-rounded as you can be. One of the mistakes that I made in my training and education is I was so fixed on my end goal, I didn't take any time off. I went from high school to college to medical school to residency to fellowship to working. And in retrospect, it's a long time. It's 15 years of training. I could have taken 3 months or 6 months off to pursue some random dream or goal to go to Europe and see what being a waitress in France for a summer would be like. But I didn't, because I was so fixed on the end goal. I was in such a hurry to get there. In some ways, I wish I would have slowed down a little bit along the journey to enjoy what was going on around me. And I think that would have made me even more well-rounded and maybe even a better candidate in terms of applying to medical school and residency.
What's next for you? What do you do? Is it true that surgeons can only really be in surgery up to a certain point?
Not really. I know some folks who are actively practicing well into their late 70s and early 80s. The OR is where I come alive. I love being in the operating room. I love operating. Put a party dress and gloves on me, and I'm a happy girl. So I don't ever see myself getting away from that. But the medical education, I think, is a very exciting field. I think the way that we train medical students and residents is going to continue to evolve, much the way that education of junior high and high school students has evolved. The Congress has passed laws in terms of work hours, and so we have less and less time to teach our residents more and more. It's not like there's less to learn now than there was 10 years ago. So I think it's going to become even more of a challenge. I really like the medical education aspect of my job. I mean, it's awesome to be able to help surgeons become what they're supposed to be. Our graduation is in 2 weeks, and I have 3 chief residents who are about to go out into the world, and they're all pursuing fellowship training, but I can look at them and say, man, we trained them, and they turned out really well. I see myself doing more in medical education. when I grow up, maybe I'll be a medical education dean, a dean of student affairs at a medical school, or something a little bit higher up in a university setting. But I think it will definitely be focused on education while allowing me to have a clinical practice.
You live in Scottsdale, grew up in Willmar. What's the difference besides sunlight?
Scottsdale is a suburb of a fairly large metropolitan area. So I would say the biggest difference, especially when I was growing up, the only real restaurant were Perkins and McMillan's. There's a ton to do. There are tons of restaurants. I would say people are the same. They're still hardworking folks who are out trying to get someplace and give their child a better life than they had. But it's sunny 340 days out of the year. It's hot, but there is no humidity. I have yet to be bitten by a mosquito in Arizona. And it's just a big place full of possibilities.
Did you make any snowballs this year out in Scottsdale?
The one day that we had snow, absolutely not. I laughed at everybody who took pictures of it because some had never actually seen snow in person.
Well, I think we got all the snow that was meant for you this winter.
I'm pretty sure you did, and I will say this winter in particular convinced me that I may never come back to the Midwest. In fact, I don't even know if I'll come back and visit between the months of October and, well, now May. I don't know if it's safe to visit in May.
Well, we're glad that you came to visit us today, and it was really great to meet you.
Thank you for having me. It's an honor to come back.
I hope you enjoyed my visit with Dr. Elizabeth Nesset, and I thank her very much for coming to Willmar to visit. And remember, today's Willmar student could be tomorrow's reconstructive plastic surgeon.